Hi there, and welcome to this talk. What I want to go over in this video is how to recognize the early signs of cancer. Most people watching this know that early detection and treatment make a huge difference. If you catch cancer early, your chances of recovery and remission increase dramatically. So, over the next 20 minutes, I'm going to share a lot of useful information. It might feel a bit like a lecture, but I promise, if you hang in there, this could potentially save your life or the life of someone you care about. So, what are the early warning signs of cancer? What should make us think, wait a second, maybe I need to talk to a doctor? Let's get into it. We're focusing on spotting cancer early, which is when it's most treatable. Now, a lot of these notes come from my book, which you can download for free. I'll drop the links. I've updated a few things, but the foundation is the same. Unexplained bleeding. First up, let's talk about blood where it doesn't belong. Blood in the urine. This is called hematuria. It's never normal. The normal amount of blood in urine? 0. If you see blood in the urine, it should always be investigated. The only exception is during a woman's period, when blood might contaminate the sample. But even then, don't assume. Check again about 2 weeks later, mid-cycle. If blood is still showing up, it needs to be looked into. Most of the time, the repeat sample is clear, but it's important not to ignore it. There are 2 types of blood to keep in mind: frank and occult. Frank blood is visible. It's obviously blood. Occult blood is hidden, only detectable with testing. You might not see it, but a quick test with a dipstick or lab work can tell you if blood is present. Sometimes, blood that's been digested or altered, like in vomit, looks like coffee grounds. Any of these signs mean it's time to see a provider. So, again, if you're female and see blood in the urine, recheck in a couple weeks when you're not on your period. Vomiting blood, hematemesis. Vomiting blood is never normal. Sometimes intense vomiting causes a small tear in the stomach or esophagus, which isn't cancer, but blood in vomit still needs to be checked. Blood in sputum, when coughing, is another red flag. Around the world, the most common causes are tuberculosis and lung cancer. If there's blood in your mucus, don't ignore it. Talk to a doctor. Blood in the stool. When there's blood in your stool, it can be dark, tarry, or bright red, depending on where the bleeding is coming from. Melena is the term for dark, tar-like stools, usually with a distinctive smell. This usually means bleeding from the upper GI tract, like the stomach or esophagus. Bright red blood may indicate a lower issue, like hemorrhoids or rectal bleeding, but again, we can't assume. Anytime you see blood, frank or occult, talk to your provider. Recurrent episodes especially need follow-up. Vaginal bleeding. Pervaginal PV bleeding at unusual times is always abnormal. Bleeding between periods, bleeding after intercourse, bleeding after menopause. Even a small amount is worth checking. Don't assume it's just hormonal or minor. If it's not part of your normal cycle, get it checked. First, confirm it's really blood, simple to test. If it is, follow up right away. Nosebleeds. Frequent or unexplained nosebleeds should also be checked, especially if they're not caused by trauma. Yes, most nosebleeds are from picking your nose or dry air, but if they happen a lot without a clear reason, a doctor should evaluate it. Colon polyps and screening. Polyps in the colon are precancerous growths. In many countries like the UK, people over 60 are routinely screened for occult blood in the stool, because it may indicate a polyp or something more serious. These tests help catch things early, before they become cancerous. Bruising. Bruises are internal bleeding from tiny capillaries, blood leaking under the skin. While usually harmless, unexplained or frequent bruising could be a clue. Remember, it's still a form of bleeding. Discharges. We often think of discharges, pus or mucus, as signs of infection, and most of the time they are. But sometimes, a tumor can block a duct or passage, leading to infection-like symptoms. For example, a tumor in a breast duct or airway can change the structure of that area, preventing it from clearing itself normally. That can lead to discharge. So while discharges are usually infections, they can occasionally point to an underlying growth. Repeated chest infections or a persistent cough need to be checked. Pus from the urethra usually signals an STD, but not always. Nipple discharge in both women and men is abnormal and should be investigated. And of course, vaginal discharges outside the norm should also be reviewed. Bowel habit changes. Any change in your usual bathroom routine is worth noting. That includes frequency, going more or less often, consistency, constipation or diarrhea, stool shape or size, color changes, presence of mucus. These could be caused by something benign or something more serious. Doctors can easily check with basic tests. Dark stools may mean blood. Very pale or clay-colored stools might mean bile isn't reaching the intestine, possibly due to a bile duct blockage, which could be caused by a tumor, like in the pancreas. Floating stools. Floaty stools can indicate high fat content, meaning fat isn't being digested properly. This could be from blocked pancreatic ducts. Again, not always cancer, but a red flag worth checking. Stools that are greasy, hard to flush, or oily, that's called steatorrhea, and could indicate malabsorption issues, including possible pancreatic problems. Dark urine. If your urine is unusually dark and you're well hydrated, this might suggest bilirubin is being diverted into the urinary system instead of into the gut. Another possible sign of a bile duct obstruction. Abdominal swelling or bloating. If your belly seems unusually bloated or swollen, especially if it's persistent, that needs medical attention. Don't just chalk it up to something I ate. Indigestion or heartburn. Many people deal with occasional indigestion. I take antacids sometimes myself. But if your symptoms are new, getting worse, or changing in character, it could be something more. Specifically, cancer of the esophagus, cancer at the top of the stomach, fundus. These conditions can cause indigestion-like symptoms. So if you have new or worsening heartburn, don't ignore it. Persistent bloating and loss of appetite, also known as anorexia, can sometimes be a sign that something's not right. If you notice a change in your usual appetite and can't explain why, ask yourself, is this different from what's normal for me? You know your body better than anyone else. If something feels off, consider whether it's worth getting checked out. Most of the time, a few quick and simple checks by a nurse or doctor are enough to rule out anything serious. These are routine procedures, and more often than not, they'll offer reassurance. But in the rare cases where something more concerning shows up, your provider can refer you for further testing or diagnostic procedures if needed. Changes in how you empty your bladder, what we call lower urinary tract symptoms, LUTs, can also be worth checking out. These include needing to urinate more often, difficulty starting urination, feeling like you have to go all the time, or just dribbling instead of a strong stream. While these symptoms are often linked to an enlarged prostate, especially in men over 60, they could also indicate something more serious, like a malignancy. Simple testing usually gets to the bottom of it. No need for anything high-tech in most cases. Feeling a thickened area of tissue or a lump is another common concern when people think about cancer. While lumps often turn out to be harmless, benign, a few do end up being cancerous. Cancerous lumps tend to be hard and fixed in place, meaning they don't easily move around when you press them. Benign lumps, like cysts, are typically softer and more movable. But it's not your job to figure that out. If you feel a lump, have someone check it who does this professionally. Doctors can usually tell a lot just by feeling it, and if there's any doubt, they'll arrange a biopsy. These straightforward steps can truly be life-saving. Breast and testicular cancers, for example, often show up as a lump. In testicular cancer, Pain usually isn't the first symptom. More often, one testicle feels heavier than the other. The best time to examine yourself is after a warm shower or bath. If one testicle seems to hang lower or feels heavier, that could be a sign to get it checked. Testicular cancer is most common in young men, typically in their late 20s to early 30s. It's much less common as you get older. Fortunately, treatments are highly effective if caught early. Breast awareness is also important. Regular self-checks can help you notice changes early. Swollen lymph nodes, whether under the arms, in the groin, or beneath the jaw, could be a sign of infection, which is usually harmless. But again, it's not up to you to diagnose. That's what doctors are for. They can assess whether it's just an infection or something that needs further investigation. Don't try to self-diagnose. That's what healthcare professionals are trained to do. And yes, it can be hard to get an appointment these days, but it's still something you need to follow through on. A lingering cough or a hoarse voice, if it lasts longer than usual, shouldn't be ignored. These are common with colds and infections, and COVID-19 can drag them out even longer. But if symptoms linger well beyond the typical recovery time, get them checked. Persistent hoarseness, for instance, might be something simple like laryngitis, but it could also indicate something more serious, such as laryngeal or thyroid cancer. The recurrent laryngeal nerve, which runs near the thyroid, affects the voice. Pressure or damage here can change your voice. A persistent sore or wound that doesn't heal should also raise concern. We call this malignant ulceration. While most wounds get smaller over time, cancerous lesions tend to grow. A wound that's growing instead of healing needs to be looked at. Increasing pain or unexpected bleeding from a sore could also point to something more serious. Skin cancers like basal cell carcinoma or what's known as rodent ulcers are usually visible and on the skin's surface. Still, you shouldn't assume they're harmless. Let a healthcare provider decide. New or changing moles are another big red flag. If you notice a mole that wasn't there before, or if an existing mole starts growing, changing color or shape, or if parts of it become raised or sunken, that needs evaluation. Dermatologists can often tell just by looking, and if there's any uncertainty, they'll order a simple biopsy. Under a microscope, pathologists can definitively say whether the cells are normal or cancerous. It's quick and accurate. If you have a mouth sore or tongue ulcer that lasts more than 3 weeks, that's not normal. Have a dentist or doctor check it out. That's what they're trained to do. Changes in a wart or mole can also be important warning signs. Look out for the ABCDEs of melanoma. Asymmetry, not the same on both sides. Irregular borders, color changes or multiple colors, diameter larger than 6 millimeters, and elevation or uneven surface. Malignant melanoma is mostly caused by sunburn, but it spreads, metastasizes fast. Even small lesions can have already spread. So early detection is critical. If you're having trouble swallowing, feeling pressure in your throat or chest, don't ignore it. It could be something like esophageal or stomach cancer, or even an issue in the neck or diaphragm. The medical term for this is dysphagia, and it's worth having evaluated. Waking up drenched in sweat or running a fever at night isn't something to brush off. Night sweats are not normal and could be a sign of infection, or, in some cases, cancer. Sometimes this happens as a paraneoplastic syndrome, side effects of cancer. Sure, it could also be menopause or something less serious, but let a doctor figure that out. Feeling constantly tired without a clear cause, unusual fatigue, can be related to many things, including thyroid problems. But persistent fatigue is also seen in some cancers. Simple blood tests can usually rule this out or catch it early, so don't delay. And finally, if you're losing weight without trying, especially if you're not dieting, that's worth checking out. While it could mean diabetes or other conditions, unexplained weight loss can also be a sign of cancer. Cancer speeds up metabolism, sometimes leading to severe weight loss, or what's known as cachexia. So if your weight is dropping for no clear reason, make an appointment. Unexplained aches or pains, especially if they stick around, shouldn't be ignored. Here's a general rule of thumb. If something's been going on for a while and it's not improving, that's a red flag. Typically, when something's wrong, the body heals itself. But when it doesn't, it might suggest there's an underlying issue that isn't resolving on its own. Cancer is one of those possibilities, so persistent. Unexplained aches or symptoms, especially when they don't go away, should be checked out. Another thing to watch out for is the development of new blood clots, like deep vein thrombosis, DVT. Cancer can change how the body functions, including how the blood clots. In fact, for some people, the very first sign of cancer is a blood clot in the leg, without any history of similar issues. DVT can be serious and may lead to pulmonary embolism. This condition is known as venous thromboembolism. If you get a blood clot, don't just assume it's no big deal because the treatment made it better. Keep in mind, it might be a symptom of something more serious. Bone pain can also be a warning sign. Sometimes it's associated with blood-related cancers. Again, it's worth getting evaluated. Ongoing infections, no matter where they show up, can also be important to track. Cancer Research UK emphasizes the importance of knowing what's normal for your body. Also share a helpful visual summary that's worth printing out and keeping in plain sight. It captures all these signs clearly and simply. Most of the time, these symptoms won't turn out to be cancer. But the key is, don't ignore them. Because the one time you or someone you know brushes something off, it could be the real thing. If you catch it early, treatment is far more likely to work. That's the point. I've worked with many cancer patients in my healthcare career, but what sticks with me most are a handful of moments where someone casually mentioned a symptom, and something in my gut said, "Hold on, that could be serious." For example, someone once said, "Oh yeah, I had blood in my urine last month, but it went away, so I forgot about it." That's not okay. Even if it only happened once, blood in the urine is never normal. That's always something you need to have looked at. In everyday conversations, whether with family, friends, or coworkers, has led to someone going to the doctor. Most were told everything was fine, but a few did end up being diagnosed with something that needed treatment. And in those cases, it made all the difference. That early medical advice quite literally saved lives. So we'll end on that note. Yes, there's been a lot of information here, and we make no apologies for that. It's important. Right now, we're seeing an increase in cancer diagnoses. And though I won't go into all the reasons for that here, I suspect we'll be seeing even more in the coming years. The takeaway? Stay alert. If something seems off, get it checked. The sooner cancer is caught, the better the chances of successful treatment. Thanks for watching.